Manur, and today I will be briefing you about the types of research. The choice of study type is an important aspect of the design of a research. It basically determines the quality and the clinical value of a research. Now arises the question, then why is there a need of more types of research? It basically enables you to use that evidence that is obtained to answer a research problem as unambiguously as possible. First of all, we have letter to the editor. A letter to the editor is like a small communication on any topic that just grabs the attention of the readers. It can also be written on any previously published article. A letter to the editor should have a purpose and should define this purpose in a very short and definitive fashion. Here is an example of a letter to the editor that is being published in a medical journal. Then comes the case reports. So, case reports usually describe an unusual or novel occurrence that have occurred and basically provides new ideas in the medicine. It just provides an extensive review of the relevant literature on any of the topic. It can discuss rare presentations, unique cases, new side effects, or new and unexpected association in disease progression. Here is an example that is about spontaneous pneumomedicinum and subcutaneous emphysema in a non-intubated COVID-19 patient, a case report. Then comes a cross-sectional study. So, a cross-sectional study looks over a specific part of a population in a specific period of time. For example, you take a slice of a population and then record variables for every participant. An observational study that looks at a particular group of subjects at a point in time. It studies the presence or absence of an exposure in a specific period of time or the presence or absence of an outcome in the people. The invigilator measures the outcome and the exposures in the participants at the same time and measure the prevalence of those outcomes and determinants of the disease. For example, there's a population-based survey is designated and conducted in a village to assess the prevalence of vitiligo. The participants are recruited based on the exclusion and inclusion criteria. Then after that, the researcher would study the exposure and outcome at the same time in a specific period, and then they will estimate its prevalence. Then comes the CAP study. CAP stands for Knowledge, Attitudes and Practices. It is a representative study of a specific population that collect information about what is believed, known, and done regarding a particular topic. It is conducted to record data on the knowledge, attitudes, and practices of a particular topic in a population. It just deepens the understanding of information, attitudes, and factors that influence the behavior. It is highly focused with a limited scope, so cost effective. And up to 50 references you can use in it, and it varies from journal to journal. It depends on the researcher degree of familiarity with the culture, and it is not a standardized approach, and the results difficult to interpret. Here's an example of a CAP study, which is a comparative study of students from medical and non-medical fields. Then comes the prospective cohort study. A prospective cohort study in which you take people and then study them for a limited period of time. None of the participants show the condition of interest. You watch for outcomes such as the development of a disease during the study period and then relate this to the other factors such as the suspected risk or protection factors. The invigilator begin enrolling subjects and collecting baseline exposure information. The individuals are followed over a long period of time and the data of outcomes is collected as their symptoms, characteristics, or circumstances. Here is an example. Then comes the opposite, the retrospective cohort study, in which you take conceived after some people have already developed the condition of interest. You take the people and study them who has that condition and then generate outcomes from that. You look backward and examine exposure to suspected risk or protection factors in relation to an outcome. That what was the reason that now the population is showing this disease or showing this particular characteristic. You can test a potential hypothesis regarding suspected risk factors in relation to an outcome. Here is an example that the employees of a tire manufacturing company So some of them were exposed and some of them were not exposed, and this basically leads you to the reason that why they are showing these characteristic symptoms. Then comes narrative review. A narrative review is just basically identifying and analyzing what previously has been published. It is used to record and track the data and the changes which has occurred in this given period of time. It basically just deepens the understanding in a particular research area. It is a survey of scholarly sources on any specific topic. It synthesizes and critically evaluates to give a clear picture of the state of knowledge. It focuses to summarize and synthesize the arguments and ideas of others without adding new contributions. Here is an example with it is written that exploring the impact of the COVID-19 pandemic on provision of cardiology services, a scoping review. Then comes systematic review. A systematic review, the main object of this review is to maintain a highly formed research question. A review of a clearly formulated question that use systematic and reproducible methods to identify, select, and critically appraise all relevant research, and to collect and analyze data from the studies that are included in this review. It answers a focused research question by employing a comprehensive, reducible search strategy. It presents an unbiased, balanced summary of findings to reduce bias and are more likely to produce reliable and accurate conclusions that basically answers your research question. It identified the knowledge gaps that call for more research and gave an idea of how well findings might apply to everyday practice. It can be time consuming and it is difficult to summarize all the studies. It needs 8 to 10 authors, maximum 12, up to 50 references that depend on the journal. Meta-analysis, a systematic review with an added statistical viewpoint. A statistical process that combines the findings from individual studies. It helps identify the questions which has already been answered but remain and which that remain to be answered to identify and plan new studies in the future. The systematic review and meta-analysis is the use of well-recognized and systematic method to account for differences in sample size, variability, study approach, findings, and test sensitivity of data. It cannot be used for data that is dissimilar or qualitative. Here is an example of a systematic review: efficacy of heart transplantation in patients with a failing fontan. A systematic review and meta-analysis that basically answers a well-defined research questions and use of qualitative and quantitative methods to analyze the obtained data and answer that research question. With that, I'm done with explaining you the types of research. I hope this video was helpful for you.